Today we will learn about the latest techniques for removing glasses in 2025. If you are also planning to get rid of your glasses, it's important to know which technology is best for you. There are two primary methods of vision correction. The first is laser technology. In this, the shape of the cornea, the black part of the eye, is changed so that the light rays entering the eye focus directly on the retina, which allows you to see clearly without glasses. The second is lens technology. This has two types, ICL and RLE. ICL is a very thin lens that has your glasses power, which is implanted inside the eye. For those people who are not suitable for ICL or Lasik, we have RLE or CLE technology available. In RLE, the natural lens of the eye is removed and replaced with a lens that combines the power of both natural lens and glasses so that your glasses are gone permanently. Usually, these lens technologies are used for people who are not suitable for laser technology. ICL or RLE is mostly done when your power is quite high, above 8, or your corneal thickness is low. Now talking about the laser technology, there are three types of procedure under this. The first method is flap-based procedures. This includes Lasik, Contoura and IntraLASIK. In this, a thin flap is created on the cornea using blade or laser, and then laser is used to reshape the cornea, after which the flap is put back. In topo-guided Lasik or Contoura, corneal polishing is also done, which works on corneal irregularities and gives you even better clarity than before. Wavelight plus IntraLASIK is the latest in this category. It includes ray tracing technology, which not only analyzes the outer surface of the cornea, but also the inner corneal surface, lens and retina to create a 3D model of your eye and perform a completely customized treatment. Let's now look at the advantages and disadvantages of flap-based procedure. The main benefit of flap-based surgery is that recovery is very fast. You can see much better in just 1 to 2 days. But talking about disadvantages, the complication rate during and after surgery is slightly higher compared to flapless Lasik. The major complication during surgery is flap not being created properly. After surgery complication can include flap dislocation, flap wrinkles, epithelial ingrowth and corneal ectasia. Flap wrinkles occur when the flap does not heal completely. Corneal ectasia is a serious complication. When too much corneal tissue is removed, the cornea becomes weak. This can result in permanent vision distortion or progressive myopia. In extreme cases, a corneal transplant may be needed. Epithelial ingrowth happens when epithelial cells starts growing under the flap. This layer can form between the flap and cornea, distorting your vision. In severe cases of this, flap repositioning surgery may be required. Since Contoura or IntraLASIK is a flap-based procedure where a thin flap is created with the help of blade or laser, it can impact long-term corneal strength. That's why flapless procedure like SmartSurf and CustomEyes are being preferred nowadays. The second method is lenticule extraction technique like Smile or Silk. In this, instead of making a flap, laser directly goes inside and creates a thin lenticule, which is then removed through a small cut using instruments. Talking about advantage, since there is no flap, the chances of complication are lower compared to flap-based surgeries. In terms of recovery, it usually takes about 4 to 5 days to recover. Now for the disadvantage. During surgery, some complication may still occur such as incomplete lenticular dissection, suction locks, black spots and corneal ectasia. Sometimes due to low laser energy or issues in surgical technique, the lenticule may not be fully separated or may tear. It can also lead to formation of multiple black spots leading to distortion of vision. Corneal ectasia is again a serious complication. Removing too much corneal tissue can weaken the cornea, leading to permanent vision distortion and progressive myopia. In extreme cases of this, corneal transplant may be needed. Finally, coming to the third category, which is the flapless surface ablation procedures like TransPRK, SmartSurf and CustomEyes. These are one-step processes that are touchless, flapless and painless. In other procedures like Silk, Smile or Contoura, a cut is made on the eye, but in these you don't even need to touch the patient's eye to remove the glasses. The most advanced and latest among these is CustomEyes with Foresight. In this, a virtual 3D replica of the eye is created, which is just like a real eye. Then using AI-based software, a customized treatment plan is prepared. Now talking about the advantage and disadvantage of the flapless procedures, the biggest advantage of flapless procedure is that there is no risk of flap or lenticule related complication. So it's a no tension surgery for both patient and surgeon. Secondly, during surgery, there is absolutely no pain. So patient who fears surgery or feel anxious can go through this surgery comfortably. It's a painless and is completed within 4 to 5 minutes. Third, CustomEyes offer many advanced features that no other specs removal surgery provides, like advanced tracking, dynamic cyclotorsion to track every eye movement every second, maximum tissue saving which preserves maximum corneal strength, and analysis of 1 lakh data points with smooth pulse laser to provide HD quality vision which is even better than your specs. Fourth, CustomEyes has a new software called Foresight technology that can predict your post-surgery results in advance. This revolutionary software shows patients their expected result even before the surgery, helping them undergo the surgery without fear. Not just that, this surgery is ideal for sports person and defense personnel since there is no flap, there is no risk of flap dislocation if they get hurt. Second, patients with thin corneas who are not suitable for flap or lenticule creation can go ahead with this surgery. Third, people with glaucoma or retinal problems, since flapless Lasik is minimally invasive, they can go ahead with this surgery as well. Talking about the disadvantages, it takes around 5 to 7 days for full recovery. For the first 24 hours, you may feel a little burning or irritation in the eyes. Lastly, when it comes to complication, while the risk is minimal, in very rare cases, corneal haze can occur. Corneal haze refers to cloudiness in the cornea, which can sometimes be seen in high-power patients, but it usually gets treated with medicines. At EyeMantra, LASIK surgery starts at 12,000 per eye. If you also want to get rid of your glasses, call our helpline number today to book a free consultation. And if you have any question related to surgery or any issues with your eye, feel free to ask us in comments.